Hi, I'm Dr. Cooley, and I'll be talking about my specific systematic approach for using AK and fixing muscle testing findings. In my previous videos, I kind of talked about why someone would want a muscle test and what a muscle test is. But just a quick reminder: a muscle test is a reflection of the nervous system. So what's going on with the nervous system will show up in a muscle test. The problem is trying to figure out what is stressing the nervous system or what is causing the nervous system to react in this way to cause a muscle testing finding can be difficult at times. It can be very confusing. So that's why it really pays to have a systematic approach to go about evaluating these different nervous system dysfunctions. And there's ultimately an optimal order in which things should actually be done to a patient. And my approach is basically comes from two doctors out of North Carolina, Dr. Walter Schmidt and Dr. Steve Gangemi, and basically try to emulate their approach where they're gonna try to figure out what's the highest priority item on a patient. And to me, there's really one part on a patient that should get treated and evaluated at any point in time. And well, in general, the highest priority item to a patient is whether or not they have an injury going on at that time. And that's more of a survival mechanism why that would be in place. Like your nervous system is going to prioritize injuries over anything else. Like if you have an injury, so you're sending this big pain signal into your body, your nervous system wants to take care of that first before it worries about dealing with some infection or whether or not you can reproduce babies. So the dealing with injuries is definitely the most important thing that I can start with. After that, there are other things that are highest priority items. So things like dealing with an immune issue or dealing with an inflammatory issue, those things are very high priority items, because if I can fix those things, a lot of other complaints will just get better. So for more information on that, you can refer to my patient manual or email me. I'll be glad to answer any questions on that.